Now, if you want to keep the ratings diary in writing, please note, you need to pay Leo and Layla's health insurance. Because you just drive your automobile down the Grand Canyon on them when they are talking to the people from history. And yet they are definitely need to go straight to the hospital. And matter of fact, we should take Leo and Layla to the ER room instead. Why? Because what you did, that's a medical emergency.
Bingle bongle dingle dangle, yickety doo, yickety da, ping pong, lippy tappy too-ta.
And that's when some people are charged with a serious crime. And that's why you need to contact an LAWYER that knows the criminal system to fight for your CASE. Call the number on your screen for a free legal case or EVIEW.
I knew I should have curtsied. What is Stellara, ustekinumab? Stellara is a prescription medicine used to treat adults and children 6 years and older with moderate to severe psoriasis who may benefit from taking injections or pills, systemic therapy, or phototherapy, treatment using ultraviolet light alone or with pills. Adults and children 6 years and older with active psoriatic arthritis. Adults 18 years and older with moderately to severely active Crohn's disease. Adults 18 years and older with moderately to severely active ulcerative colitis. Important safety information. Stellara is a prescription medicine that affects your immune system. Stellara can increase your chance of having serious side effects, including serious infections. Stellara may lower your ability to fight infections and may increase your risk of infections. While taking Stellara, some people have serious infections which may require hospitalization, including tuberculosis, TB, and infections caused by bacteria, fungi, or viruses. Your doctor should check you for TB before starting Stellara and watch you closely for signs and symptoms of TB during treatment with Stellara. If your doctor feels that you are at risk for TB, you may be treated for TB before and during treatment with Stellara. You should not start taking Stellara if you have any kind of infection unless your doctor says it is okay. Before starting Stellara, tell your doctor if you think you have an infection or have symptoms of an infection such as fever, sweats, or chills, muscle aches, cough, shortness of breath, blood and phlegm, weight loss, warm, red, or painful skin or sores on your body, diarrhea or stomach pain, burning when you urinate or urinate more often than normal, feel very tired, are being treated for an infection or have any open cuts, get a lot of infections or have infections that keep coming back, have TB or have been in close contact with someone with TB. After starting Stellara, call your doctor right away if you have any symptoms of an infection, see above. These may be signs of infections such as chest infections or skin infections or shingles that could have serious complications. Stellara can make you more likely to get infections or make an infection that you have worse. People who have a genetic problem where the body does not make any of the proteins interleukin-12, IL-12, and interleukin-23, IL-23, are at a higher risk for certain serious infections that can spread throughout the body and cause death. People who take Stellara may also be more likely to get these infections. Cancers. Stellara may decrease the activity of your immune system and increase your risk for certain types of cancer. Tell your doctor if you have ever had any type of cancer. Some people who had risk factors for skin cancer developed certain types of skin cancers while receiving Stellara. Tell your doctor if you have any new skin growths. Posterior reversible encephalopathy syndrome, PRES. PRES is a rare condition that affects the brain and can cause death. The cause of PRES is not known. If PRES is found early and treated, most people recover. Tell your doctor right away if you have any new or worsening medical problems, including headache, seizures, confusion, and vision problems. Serious allergic reactions. Serious allergic reactions can occur. Stop using Stellara and get medical help right away if you have any symptoms of a serious allergic reaction, such as feeling faint, swelling of your face, eyelids, tongue, or throat, chest tightness, or skin rash. Lung inflammation. Cases of lung inflammation have happened in some people who receive Stellara and may be serious. These lung problems may need to be treated in a hospital. Tell your doctor right away if you develop shortness of breath or a cough that doesn't go away during treatment with Stellara. Before receiving Stellara, tell your doctor about all of your medical conditions, including if you have any of the conditions or symptoms listed above for serious infections, cancers, or PRES. Ever had an allergic reaction to Stellara or any of its ingredients? Ask your doctor if you are not sure. Are allergic to latex? The needle cover on the pre-filled syringe contains latex. Have recently received or are scheduled to receive an immunization, vaccine. People who take Stellara should not receive live vaccines. Tell your doctor if anyone in your house needs a live vaccine. The viruses used in some types of live vaccines can spread to people with a weakened immune system and can cause serious problems. You should not receive the BCG vaccine during the 1 year before receiving Stellara or 1 year after you stop receiving Stellara. Have any new or changing lesions within psoriasis areas or on normal skin. Are receiving or have received allergy shots, especially for serious allergic reactions. Receive or have received phototherapy for your psoriasis. Are pregnant or plan to become pregnant. It is not known if Stellara can harm your unborn baby. You and your doctor should decide if you will receive Stellara. Received Stellara while you were pregnant. It is important that you tell your baby's healthcare provider before any vaccinations are given to your baby. Are breastfeeding or plan to breastfeed. Stellara can pass into your breast milk. Talk to your doctor about the best way to feed your baby if you receive Stellara. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Know the medicines you take. Keep a list of them to show your doctor and pharmacist when you get a new medicine. When prescribed Stellara, use Stellara exactly as your doctor tells you to. Stellara is intended for use under the guidance and supervision of your doctor. In children 6 years and older, it is recommended that Stellara be administered by a healthcare provider. If your doctor decides that you or a caregiver may give your injections of Stellara at home, you should receive training on the right way to prepare and inject Stellara. Your doctor will determine the right dose of Stellara for you, the amount for each injection, and how often you should receive it. Do not try to inject Stellara yourself until you or your caregiver have been shown how to inject Stellara by your doctor or nurse. Common side effects of Stellara include nasal congestion, sore throat and runny nose, upper respiratory infections, fever, headache, tiredness, itching, nausea and vomiting, redness at the injection site, vaginal yeast infections, urinary tract infections, sinus infection, bronchitis, diarrhea, stomach pain, and joint pain. These are not all of the possible side effects with Stellara. Tell your doctor about any side effect that you experience. Ask your doctor or pharmacist for more information. Please read the full prescribing information and medication guide for Stellara and discuss any questions you have with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.